So today we have our very good guest, Mike Edwards, doctor of physical therapy. I met him during the Denver fascial dissection, and it was a great week. It was a really good week, and we got to know each other a little bit. And very interestingly, I found his Instagram handle to be very interesting. It's fascia around and find out. So today we're going to fascia around and find out more.
Ah, I love it. I love
Right,
it. I'm glad you
right.
like that because I love it. When I thought of it, I was like, this is perfect, man. This is so perfect.
Yeah, I mean this is a very clever name.
Thank you,
So
bro.
so recently you had a opportunity to speak at the NASCA Nevada clinic, right? About
Yep.
about fascia. Talk to me a little bit about that.
I spoke about the thoracolumbar fascia specifically
Hmm.
as its job, its anatomy, and what role it plays in, for big reason for what many people come see me for, low back pain.
Right.
Even though I was speaking to mostly I think strength and conditioning or upcoming athletic training students mostly, but possibly very much more looking to do PT. You know, it's terms of like being the largest force transmitter. That was the title of my talk, and I really didn't have don't have any real proof of that in terms of like research to say, hey, look, this is what we found. But I think, if you think about the muscles that attach to the specifically or directly to the fat, thoracolumbar fascia, the latissimus dorsi, and the gluteus maximus, you can make an argument for it. And then there was some other fascia pieces like the plantar fascia and the palmar fascia that might be considered also some of the baddest mother fascias in the body. But we had a good time. It was great.
So what are some of the interesting facts about this particular area of the fascia?
Well, we just mentioned one of the big ones, right? The connection between the glute and the lat and its contralateral unification, as well as just connecting the top and the bottom half of the body. There's a high innervation of this fascia, much more than probably some of us suspected. It turns out that the fascia, thoracolumbar fascia, has, well, excuse me, not thoracolumbar specifically, but fascia itself has about 1.7 times more innervation than muscle itself. So that's a really fun fact. And we think about the innervation of the thoracolumbar fascia, it is um, three times that of the latissimus dorsi, um, which I thought to be also very interesting. So it just kind of speaks into the role of what its most primary job is to be the information provider for what's happening top up, top, and down low, even more so than its force transmission capacity. But you can make an argument for both.
Right, right.
Yeah.
So, for example, the people who tend to develop lower back pain, what do you think is happening there? What do you theorize what's the problem is with the this area of the fascia, or it could be a combination of both.
Low back pain is, I think, multifaceted, and so to try to put it all in one cup can be a challenge. But mechanically and structurally, we think about things like disc disease and arthritis. But when we're thinking of fascia specifically, we're thinking about things like the shear forces of the way the layers of that thoracolumbar fascia are gliding on top of one another. And turns out there's some evidence that shows that there's about a 30% decrease or increase in shearing force in that region when that's attributed to non-specific low back pain. So that's a very fun fact because through most of my career, I've really just kind of focused on muscles and structure with little to no consideration to tissue gliding. Since I took this same dissection course a year prior to us meeting.
So, like when you did the dissection and then
Yep.
hold the thoracolumbar fascia in your hand and look at its relationship with rest of the musculature, what was your feeling on it?
It's like I opened up the talk by using or hopefully using the theme that everything is connected. And it seems like when you look at thoracolumbar fascia, it's almost like the if you were a marionette puppet and I could, hold you up on my fingers by your thoracolumbar fascia, it's like the everything is just connected. You can't really it's so hard to want to compartmentalize things, but it just looks like it just has all encompassing arms reaching every way around, And also just by the looks of it, it's shiny and it looks like a tendon and just like man, it's shimmering, almost like it's made out of steel.
It's also very tough.
Yeah. Yeah, there's that too, right? It's incredible. It's incredible.
What are some of the, for example, good exercises that you could suggest for example, people start to have issues in the thoracolumbar area? For example, let's say it's fascial related.
Sure. Well, I mean, I think anytime we're dealing with low back pain, I try to incorporate lots of not necessarily single leg work, but single leg loaded or with like a kickstand setup where one leg is doing most of the work and trying to establish the that connection from the glute to the lat. That's like hip hinging and those type of things is where I start with exercise and movements, but things like rolling out the bottom of your foot and even making sure your hands, fingers are stretched out and mobile, because we both know that the superficial and deep layers of the fascia both fuse at the palm and at the foot. We want to look at the body as a whole system. Those are
Right.
some of my favorites.
When we had our small talk, I remember you talk about uh, the Steckel's method of fascial manipulation, right?
Oh yeah,
Right. So do you think it's also beneficial to, for example, to apply manual therapy in that area? And what type of effect do you usually see with those type of techniques?
yeah. Well, I'd certainly be remiss if I didn't mention using manual techniques to really manipulate the fascia and soft tissue in general. That's one of the most impactful things that happened to me when I took this dissection class the year prior to is that I started to look at things so much differently through my hands. And so I guess I just have this deeper understanding now of what it is that I'm doing when I touch people, even more so. So we understand that pressure and friction create heat, and though those mechanical forces will help alter the substance that is responsible for ensuring proper gliding in the body, and that would be the hyaluronic acid. If your fans are familiar with that
Oh yeah.
phrase, I'm sure they are, right? So speaking of the stego fascial manipulation method, I'm not fully trained on it yet. However, I have signed up for the international school and intend to take it to the full 3 years, because I just can't. This new window of fascia has opened up so many other opportunities in terms of like helping people out, and I just think yes, manual techniques super important, whether it's hands-on with your hands or other devices like dry needling, um, instrument assisted cupping, whatever it is that you think fancy, but you would be remiss if you didn't put hands on your clients as a therapist, to make changes in the soft tissue mobility. You're missing like half the story. I don't know more than half. I don't, you know what I mean? Yeah, it's just crazy. You got to put hands on folks. Got to. Yeah.
Um, when you, for example, when you do palpation and then at certain area of the body, and you can tell some of the fascial densifications feels different. There is also the area of adhesions, there's area of knots, and there's area of, for example, even crazier, which is fibrosis, right?
Right.
when you palpate, you can tell, okay, there's a difference in all these type of tissues. Now, prior to, for example, understanding the fascia, what was the mainstream explanation for those areas?
I mean, I think they use scar tissue is kind of a word that comes to mind a lot, but
They use general term like a scar tissue.
yeah, yeah, without having that really nuanced understanding of the different layers. So yeah, that would be it. I think that's kind of what people lean to whenever somebody's using a manual technique and they're like breaking up the muscle or breaking up the scar tissue. Um, uh, primarily, no, I haven't you heard the word fascia so much in the last couple of years and prior to the last couple of years at all.
Right.
Yeah, which is makes me sad.
Well, yeah, I mean, this is emerging science, right? So it's something that was missed through, the fundamental research of just the dissection from the anatomical side, right? So, of course, the modalities and protocols that you develop is going to be focused on the muscle, right? It's not
Correct.
going to take consideration of the fascia. But now we understand the existence of the tissue, we understand the property and the makeup of the tissue. There's more things that we can do to help the tissue recover and become better, right?
Exactly.
Right.
Exactly. Yeah, as a whole unit. Understand that you can make changes in pain areas way far away from that source of pain, you
Right,
know?
which is remote areas.
Yeah, which makes you feel like a wizard when you do stuff like that. You know what I mean?
Well,
Yeah.
if you look at the body as a holistic network, just like, your internet connection, right?
Yes.
There's a remote desktop. So that means, I could be a guy sitting here in New York, I'm remoting, I'm doing something, I could affect what happens on your computer, right?
Yes.
So it's truly a large structural network within the body. Yeah, what about like for example nutrition wise and the from a recovery point of view. Like what do you think is good for fascia through the understanding of the fascia research?
Well, it seems like hydration is going to be key, and
Hydration.
um, proper regimen of vitamins, vitamin C being one that I know is super important for tendon health and fascial health. Collagen and protein intake. Make sure you know, have the building blocks to maintain that structure. Yeah, and avoid sugar because that will, of course, keep you in an inflammatory state and downgrade the intensity and structural integrity of your fascia. So,
Well,
yeah, those are the things that I tell folks. Yeah.
right. I mean, speaking of sugar, did you know the story of Derrick Rose, the basketball
No,
player?
no.
So it happened that, he is very obsessed about sugar.
Hmm.
So, he was at his peak, he was the youngest MVP for the league. He was one of the
Right.
youngest, but then all of a sudden he just, suffered a catastrophic injury to the knee, right? But
Yep.
if you examine an athlete's career and his lifestyle, you can find certain things that might not be very productive for the fascial structure or the fascial environment. So one of such factor is what you just mentioned there, which is the sugar.
Yeah.
So apparently, this dude he had these candy vending machines in every room.
Wow. That's
Yeah, I mean,
crazy.
the story goes that he was just constantly always wanted to have a chew on the sugar on the candy. So apparently, I mean, I didn't really believe this until I actually met somebody like this through working with the athlete. You know,
Right.
he, because one week, right, we check the body. One week, everything looks normal. Like he's the chronic issues was going away, was doing well. Like we also measure the the fascia densifications, how stiff it is. We measured that, right? So everything was doing well, and all of a sudden he's like inflamed. So I'm like, what happened? Did you have bad sleep? What happened? I was very curious. Oh, I just ate sugar. I just ate candy. I said, did you just eat, how much candy did you eat? He said he opened up the candy. He had a bag of candy. He opened up, he ate one, but then he couldn't stop. He
Oh man.
finished the whole bag. Finished the whole bag. So I was like, really? You finished the whole bag? I said, how much was in that bag? So the one piece of candy is about, like, he told me one piece of candy was about, I think was 5 grams or 5 grams of sugar. So the whole bag, at least there's like, I don't know, 100.
Wow.
So so he finished the whole bag.
Wow.
Yeah. So
That's a lot.
that's a lot. And then guess what? The inflammation, just like you said. So that was a really eye-opening to us. I mean, before, of course, before we started the program, we talk about these things, right? We talk about, yeah, we have to be holistic. We have to make sure when you do the program, you don't want to, you know, eat anything that could damage the result, damage your progress. And here we go. I mean, he just tried it. I mean, without really understanding the fact of it, but we actually get to see it in a almost like a case study sort of way.
That's that's probably very beneficial for him now
Right. So
that
now
he
he
understands.
now he understands. So
Uh,
we had to actually pause, for 2 weeks for him to just return to normal, you know?
oh
Yeah.
wow.
Yeah, it was nuts. It was and it was very significant. I'm pretty sure if the people out there who want to do the fascial research, they could design a study like this. Have somebody just a basic level fitness level athlete, right? And continues to take sugar and measure it every single week and measure their tissue stiffness.
That's
And
a good one.
yeah,
That's a
that
good one.
you're
Yeah.
probably going to see something very, very different over time. Yeah.
Yeah. Yeah. Because all the, well, metabolic garbage that stays in the tissue, and it's a very subtle swelling, I think, that we don't even recognize, and that increased viscosity, once again, um, just no bueno, no bueno for the body. Even though I love sugar, I love chocolate. I'd eat a whole chocolate bar if you let me, but moderation is the key, I think.
Yeah, moderation's the key.
Yeah.
Very good. So what about what about the from a muscular perspective? Like previously, right? So
Yeah.
there was no mention of fascia. So for example, people would say, "Oh, you have a hip flexor injury. That means your hip flexor is weak. If you have a hamstring injury, oh, it could be your hamstring is weak, right? Oh, you have a psoas injury. Oh, your psoas could be weak or something like that.
Mhm.
So now
Right.
we understand, okay, your your muscle is really living uh in this environment of fascia. Sometimes it could be viscous, sometimes it could be more liquid, right? So what do you say to that? Like once you learned about the fascia, how do you explain to people, for example, if they have, for example, hip flexor issue
Yeah.
with the fascia lids now?
That's challenging because I think most clients will like they where the pain they have has to be the source. So I just try to explain it in a way that hopefully makes sense. I say we have this suit, a skin suit that has to slide and glide. Um, and when things don't slide and glide, you can eventually develop a pain problem. And working in isolation doesn't really do much for the whole system collectively. So keep that in mind as we're prescribing some of these movements or exercises, and knowing that we're trying to impact the entire kinetic chain versus just this place that you're having pain at, because pain is just like the final straw. The house was probably crumbling long before you realized you got nowhere to sleep. So that's the approach I take. Is it's and it requires maintenance. So just because we're working on it now and you feel better, you can't just you can't stop there.
So with this new knowledge of fascia, when you're equipped with this knowledge, like when you look at weight training versus, more of a holistic exercise with the full body in different dimensions, do you have a new understanding of this?
Oh yeah. Yeah, yeah, yeah. I mean, I think going into this new fascia universe, I was doing a lot of a lot of things correctly already, I guess you could say, without the full, not that I would ever say I fully understand anything, but just like this newfound knowledge that seemed to put so many things together. I had all these questions and never really could really understand what the heck. But yeah, I've always kind of been a big fan of not really super heavy loads. In my space, you can't really go super heavy anyway, but I think there's, the speed and velocity curve, you can achieve a lot with not so much weight and be functionally very effective, and probably mitigate a lot of risk, prevent a lot of injuries because of this kind of dogma that you're probably alluding to, where we have to lift as much as we possibly can in order to be functionally fit or strong, when that certainly isn't the case, because most of us will never have to squat 500 pounds or, lift 800 pounds over our head or whatever it is. It's yeah. I think when I think back to what I used to do for my own self, like my fitness journey, I spent way too much time lifting weights in the gym. It could have been much more efficient and achieve many of the same goals. So thankfully, I can pass that along to my clients.
But now you're doing BJJ, right?
I am, yeah, yeah, I have been for the last few years. Yeah, hanging
That-
on, man, hanging on.
yeah. Well, I mean, it's good you're keeping yourself active and fit through movement.
That's right. Yeah, I can't not practice what I preach. It's just too important
Right.
to not
Do
do it.
you
I have to do it.
do you have any for example, your any advice for people who are doing BJJ? Like what is actually a good good way to, for example, warm up?
Good way to warm up. I mean, really what you want to do, I think, for a warm up is increase your core temperature to a certain degree, and everything else will work itself out. So, jumping jacks for a couple of minutes would be adequate warm up. But just some little bit of stretching and flexibility just to increase the core temperature, 5 minutes. I think, because there's so many darn exercises, we could talk about, but just adequately heating up the tissue, like we said, because that increased the viscosity of the hyaluronic acid and therefore increasing the tissue gliding, um, and then the tissue's just ready to take on the challenge without the warm up. You're not mitigating the risks. That's what I would say.
Right. So
So don't skip the warm up.
right. So increasing. So that's from a fascia perspective. Now we understand the importance of warm up because the fascia has literally thermal receptors, and it will take the information of the heat and then change its viscosity over time, right? So what was the what was the reason for doing it before we understand the fascia? Was it people just felt like, the body become more looser as the muscles are warming up?
I think so. I think so. And you mentioned it earlier. It's just the science is finally able to catch up with all of these. I think we had these questions. We go, why does this work? Like, why does massage work? And now I think we understand because we can stain tissue better. We've got ultrasound that is improved so we can see the dynamics a little bit better. But yeah. It was just a matter of trying to prime the system because I guess it seemed to feel right to do, I guess, right? Like, you know what I mean? But most of us were looking at it through the lens of muscle and tendon, and as much as as much as we want to do that, it's the whole system. You know, fascia is in the muscle, so you just want to, as a unit, warm up so we can prepare for this task that we're getting ready to tackle.
So doing the fascial dissection that you and I had, right? So which area of the body that surprises you the most anatomically with the fascia?
Shoot, man. I think well, I think really having a chance to appreciate the superficial fascia was epic, because my previous experience with cadaver dissection was with an embalmed cadaver, and it's just the tissue quality is so much different than what you experience in a fresh cadaver. So that was number one. But I think like that glute, IT band, quad, lateral, intermuscular septum, it's pretty badass. You know, it's just like that septum wall when you think about the muscles pulling from one side and the other, and then the glutes pulling that septum taut so it can properly transfer that energy. You're just like, well, that's some good nerd stuff right there. That was pretty awesome. Yeah, plus just the way the tissue looks, you know, it's like I said, it's shiny and it looks like a polished, like not steel, but like otherworldly alloy. You know, it's just you're just like, damn, son,
Yeah, it has direction.
crazy.
It has,
Yeah.
yeah, for me, I think it's what surprises me was the I think was the fascia of the upper back area where you have of course, appreciate how much of percentage the fascia was in the gluteal region.
Mhm.
But the upper back, how intricate it is, there's so many layers of muscles, and then you had these all these fascial layers gliding through it, right? In the upper trapezius, the middle trapezius. So and when I saw that, I was like, oh, because I was previously I was dealing with some people with cervical instability, cranial cervical instability, which is between the C1 to C4 area, right? So when you look at the fascial integration in that area, how delicate it is, and how the nerve that goes from the skull, right, it has to traverse through fascial compartments. You have the nerve, you have the arteries, you have the veins. They all has to be properly spaced out, right? That's all integrated by fascia. So that was very kind of eye-opening for me. Yeah.
Yeah. Yeah, I agree. I agree that that was pretty neat too. Kind of get a better idea of those slings that we talk about. Yeah, the whole thing was neat for sure. But that's awesome that you found that interesting.
In terms of, I'm sure you work with, athlete, they do a lot of power and strength type of work. What do you think of the role of fascia in, for example, strength and power?
It almost seems like fascia is an amplifier, the ability to take that potential energy and just explode into kinetic energy. We wanted to think the muscles are doing all the work, but the elastic properties of the fascia, it just allows us to be not so big and be able to lift so much heavy weight. You know, it's how do you explain those little guys that can just lift so much weight, or even the big guys that lift exponentially so much weight? You just can't. I just didn't realize how much of that force transmission, that explosive force transmission that you need, like, you know, for Olympic lift, I think you have to make sure that you give the fascia the credit for being the the attenuator, the amplifier of what the muscle itself can do. You know, we can't separate them, but want to make sure we give proper credit where credit is due, I think. Yeah, I think that's the role.
Before we learn about the existence of fascia and its functions, a lot of people say like, oh, your the rolling. I remember when I was in my 20s, that's the roller, the foam roller was first introduced. And then everyone's like, oh, that doesn't work. Or some people say, oh, it works, it makes you feel great. But now after, so many years of fascial research and people understand about the importance of myofascial release and the importance about, rolling and what do you think about that?
Well, I think it's great that people are finally coming to the light when it comes to that kind of thing. I think if a lot of people stop to listen to their body and take a few moments and buy a roller or a lacrosse ball and use those instruments in such a way to help themselves, I'd probably be out of a job because I think people that get over or are able to recover from their injuries, the ones that can intuit what their body needs a little bit more than others. And so if you just stop and listen and use those tools, um, it's an I think you can find a way to help yourself out more than you realize. And the thing about that is that using those tools, they don't just affect the muscle. Of course, we're going to once again talk about fascia releasing and um, allowing all that good stuff to move like you want it to.
Got it. And do you have any interesting stories that, for example, that you worked with uh, that by understanding the fascia somehow it helped you figure out what the problem was?
One time I saw this attorney for bilateral Achilles tendonitis, and we're doing soft tissue work on him. On the Achilles tendon specifically is his right one. I never forget it because I was reaching across from him and it cracked. It felt like those chem lights that you go and you break it and you shake it and it
Right,
like
right. It made a cracking sound.
yeah. Well,
Hmm.
it cracked and you could feel like I don't even know how to explain it, but that felt like spaghetti noodles inside that tendon. And as I was working it, eventually those noodles just slowly kind of melted away and his tendon was no longer stiff and hard. It was a little more pliable. And after that day, he never complained of Achilles pain again. And I never really understood exactly how the hell something like that happened. But now it makes sense. We, cracked that hyaluronic aggregate with the heat and the friction, and then boom, it just restored. And that was it. That was it. It was great. Yes, that's one of them. That's one of my big ones because I could never really understand what the heck actually happened in that Achilles tendon when it
Right.
cracked like that. Yeah,
So it's
that's one of my
probably
biggest ones.
so it's probably it's almost like a uh like a scar tissue or some sort of densification, fascial densification that kind of broken up by the heat and friction.
I believe so. I just like those. Yeah, it had to be. It had to be because it just melted. It was great. It was. We were both surprised. I was like, "Holy smokes, you feel that?" You said, "Yeah." I said, "Oh shoot."
That's great.
Yeah, that's
Um,
good story.
the for those people that are interested in working with you, where do they locate you in Vegas?
Well, I just recently set up shop in Tivoli Village, at the Kilo Club, which is a private gym on the second floor.
Ah,
Um, and they can that's where you'll find me at. I was going to people's homes as a mobile PT, but now I'm posted up shop in the Kilo Club and I have access to the gym. It's great. They have extensive weight room, and then they have this hot room, and then they also have a room dedicated to boxing and kickboxing because they have heavy bags in there. So when I saw that, I was very excited about that.
yeah. I mean, UFC headquarters in Vegas too. So
Yeah, yeah.
so
We talked
yeah.
about that place. That place is super cool. Yeah.
Right, right.
Yeah.
That's perfect.
Yeah.
Well, well, thank you so much for your time today. And
Heck yeah, man.
yeah, this is a lot of great information that I can share with with the audience. So they're all, very keen on learn about fascia and how it's important in resolving their issues.
Good. Glad to hear it, man.